Hello, I'm Dr. Rohini. Today I'm going to talk about iron deficiency anemia in pregnancy, which is one of the most common causes of anemia in pregnancy. So let's begin with what are the causes why people get iron deficiency. So in India, a lot of people are malnourished. So one of the major causes is low nutritional uptake. There is low intake of iron. Then also there is increased loss of iron in our from our body. How does that happen? That happens when patient gives you history that there is increased blood loss during her menstrual cycles before the pregnancy, or in case if she has undergone any blood losing surgery, or she has hemorrhoids or piles through which she's been losing blood, or also in case if there is very poor spacing between the pregnancies. For example, if the first baby was born within the 6 months to 1 year, two babies are born, then again poor spacing also causes anemia. Other than this, so this is because of low availability or low intake. And now next, one of the other causes is when there is a poor absorption of iron. This may happen if the patient has undergone any surgery where a part of intestine has been resected, because absorption of iron happens in the small intestine. And so in case patient has any absorption disorders like Crohn's disease or celiac diseases, or in case they have undergone intestinal resection, so in these patients also there is very poor absorption of iron. Now, how to treat this iron deficiency anemia? So again, this would be based on the level of hemoglobin. So according to WHO, first of all, anemia is when in pregnancy is when hemoglobin levels are less than 11. And then again we would demarcate it as mild, moderate and severe. So mild is when it is between 10 to 11, and moderate is between 7 to 10 gram, and severe is less than 7 grams. So now with this we'll get an idea of demarcation of anemia. And then after that, to confirm whether this is iron deficiency anemia, we would be doing a test called peripheral smear, where we would be seeing the shape of the red blood cells. Usually in case of iron deficiency, there are a lot of different shapes of cells like teardrop cells and pencil shaped cells. Usually an RBC isn't round in shape, but in this case all different shapes will be there. Then other than that, serum iron studies are done, in which we'll have total iron binding capacity, serum ferritin level and transferrin saturation level. Usually ferritin levels are less, iron binding capacity is more, and transferrin saturation is also more in case of iron deficiency anemia. So it's very important first that we come to a diagnosis. What is the recommended iron intake in case of pregnancy? Usually around 6 mg per day iron should be taken by the patient, pregnant woman. But the problem is that if we consume even 60%, 60 mg, usually the absorption of iron is around only 10%. So in case if I consume 60 mg of iron, elemental iron I take every day, only 10% will be absorbed, that will be around 6 mg. So usually WHO recommended is 60 mg of elemental iron intake. But whatever commercial products and medicines that which is available in the market consists of 100 mg of elemental iron. So this is the usual prophylaxis of iron that we give for every patient starting from around 10 weeks of pregnancy. So this is the routine dosage. In case of treatment, now so for treatment the available options are like commonly used the iron tablets. Instead of a single dosage, we would be giving the patient a double dosage of iron. So now this iron tablets are also available in different forms. There is iron fumarate, iron ascorbate, iron sulfate. So most commonly available iron tablet is iron sulfate. But what we have noticed is that with patients have a lot of gastritis and gastric symptoms with iron tablets, so iron sulfate. In case patient is not able to tolerate iron sulfate tablets, then they are switched to a different combination of ascorbate or fumarate. Now, how to take this iron tablet? So iron tablet has to be taken 1 hour prior to the food, because our food can interfere with the absorption of iron tablets. But if the patient is telling no, that she feels a lot of gastric irritation, then we can tell her that it's okay. Though the absorption will be little reduced, you can take iron along with your meal. And also we would be switching on to a different combination. And so what are the symptoms? What are the side gastric disturbances that patients face? One is they'll feel bloating. Sometimes some patients also get nausea, they get gastritis, they have a metallic taste in the mouth, and there'll be also discoloration of stools. So after you start taking iron tablet and you notice that the color of the stools has become black in color, so don't get scared. So this is a side effect of iron tablets. So this is what we are normally giving to the pregnant patients. For every patient we give iron tablets. Now when it comes to treatment, so for treatment of anemia, first of all, it will depend on what is the period of gestation, and also the severity of anemia. So severity, like I told you, mild, moderate and severe. So suppose, now I'll tell you also the treatment options that are available. One is the iron tablet, the next would be parenteral iron, that is iron preparations in the form of intravenous injections. So IV injections are again in the form of iron sucrose or iron carboxymaltose. So these are usually available in the dosage of, iron sucrose is usually available in ampules of 200, and carboxymaltose is available as 500 and 1000 mg, which can be given as a single dose. So these, again, there are certain scientific formulas which will help us in deciding, depending on the hemoglobin level, how much mg of iron has to be transfused. So, but there are few side effects of this iron injections also. Very rare cases we have noticed that patients developed allergy, and the allergy can sometimes be even life threatening. So it is recommended that iron injections are never taken over the counter or at your home. It has to be taken in the hospital in the presence of supervised expert staff. So in case if you have any allergy, we will give you administrative medications or immediately stop the transfusion of the medicine. Usually it doesn't take much time. The iron transfusion will be given over a period of just 20 minutes, after which you will be told to relax, rest for another 20-25 minutes, and we'll see if you are showing any signs of allergy like breathlessness or itching or any dizziness. In case if all this is fine, then you'll be sent home. So next option would be a blood transfusion. So blood transfusion, so this is reserved in case of severe cases. So if the patient presents to us in the early pregnancy and she's having just mild anemia, then we would be telling the patient that you take this iron tablets twice a day, and we will check your hemoglobin after a period of 1 month. But if the patient in the first trimester or in the beginning also, patient comes to us with severe anemia, that is less than 7 gram. So remember this, whenever anemia is severe, less than 7 gram, regardless of any period of pregnancy, we prefer to give blood transfusion for the patient. Because if anemia is very severe and it's untreated, it can also lead to heart failure. And now if patient is nearing delivery, or if she is in the other later part of the pregnancy, then in case if she's having moderate anemia, then we prefer to give parenteral iron, that is iron sucrose or iron carboxymaltose. There are other situations where we prefer to give this IV. That is when if patient is just telling that she's having severe nausea, vomiting, and she's just not able to tolerate any oral supplementation, then in that case we directly go for intravenous therapy. Or also in case we have already given the patient tablets and we have called for again repeat hemoglobin and testing, and then we realize that no, patient's hemoglobin has just not increased, then in that case also we switch to IV injections. And right at the time of delivery, usually whatever preparations we give, oral iron or iron injections, it takes around 3 weeks for the hemoglobin to improve. In case if she's just at the time of delivery, so in that case, if we feel that the patient is having even moderate anemia, that is less than 9, then we would prefer to give a blood transfusion for the patient. And if she's having just mild anemia, then we would plan delivery for the patient, reserving blood, keeping in mind that in case if there is any excess blood loss, we will be giving this blood during the delivery or during postpartum after the delivery. And taking part of your hemoglobin and your iron levels just doesn't end at the time of delivery. So usually you have to continue this iron supplementation even after 6 months of your delivery when you are lactating or you are breastfeeding the baby, because your baby receives this iron from the breast milk. So from your body, iron stores are getting depleted. So it's very important that you maintain a good health, nutrition, and you take these supplementations of oral iron even after the delivery for 6 months. I think I hope I was able to manage to inform you a little bit about iron deficiency anemia. And in case if you have any other further doubts, you can always call us or come and meet us in person.